You might have come across a lot of people telling that I underwent angiogram or some relative underwent angiogram. An angiogram is basically an image of the blood vessels supplying the heart. We call it as coronary angiography, and the actual image is called angiogram. Now, whenever a doctor suspects that the patient has any blocks in his coronary arteries, either because of his symptoms or ECG changes or a positive treadmill test, or if he comes with a frank heart attack, an angiogram is done. Usually in case of a heart attack, an emergency angiogram is done so that the anatomy is immediately visualized, the block is found out where exactly is, and it is rectified immediately. Otherwise, most of the times angiograms are done electively in a place called cath lab, which is somewhat similar to a operating theatre, where the doctor inserts a small catheter, a small plastic tube under X-ray guidance. The catheters go into the blood vessels of the heart. A small amount of dye, which is iodine based, is injected into the vessels so that the vessels become radio opaque and they are visible on an X-ray. This whole process is called an angiogram. Normally, an angiogram is done through one of the vessels from the either hand or from the groin, but most of the times it is done from the vessels coming from the wrist. Once we inject the dye, we take an image and then the image is processed and it is studied so that we exactly come to know what is the patient's condition, what are the remedies.